Hi, I'm Mary Wong, and I have promised to do a little live Q&A tonight. And this is my first time, so bear with me. So hopefully some of you are joining in, but I can always have this recorded for later so that you can find out about IVF process, how it affects you physically, mentally, emotionally, and I'm addressing some questions that was asked last night through another group. So I'm prepared to go through that. And if you want to jump in anytime to ask questions, feel free and I'll cover it. If there's not much interaction, I'll just go ahead and answer what I can. And then we'll leave it at that till next time, okay? So the very first thing is IVF process. How does it affect you physically, emotionally, and spiritually? So, for those of you who have never gone through IVF, it's not like a cakewalk because it can be quite grueling, to be honest. First, a couple of reasons. First is because you have to go to the clinic to get monitored through blood work and ultrasound transvaginally with a probe, a phallic-like probe, and you do that on a very regular basis. So it may start off on the third day of your menstrual cycle, and then subsequently you go every like third day, and then every second day, and then every day until you ovulate, at which time they'll do what we call a retrieval. But before that, there are lots of drugs that you take, and a lot of which is through injectable drugs that, frankly, most people are not a profession. It's not your profession to do injectables, but yet they show you once at a clinic, and then you're expected to be able to do that on your own, which is very difficult for most. So some people have their spouse or friends, or even at the office, where they'll do the injections, and otherwise I've had other women just do it on themselves, which can be quite tough. So difficult, right? And often, unfortunately, a lot of times people don't even have other people in their lives that really know what they're going through. So that is tough. And emotionally, it can be very wearing. And then there's side effects of the drugs that can or cannot occur for people. So, some people claim that they have no symptoms, while others, they, become a bear and a grouch because you have a lot of hormones injected into your system. And I equate it to, like, they're trying to make you like a farm animal. So when they do that, there's a lot of hormones that are extra in your body. And when that happens, then some people can get nausea or insomnia, to irritability, to bloating, breast distension. I've had some people have hives, etc. Okay, so again, there's lots there. Mentally, it can be very challenging as well, just because this is not something that you're used to. So how do you prepare for it? Well, when you prepare for an IVF, what I would suggest is that you do preconception treatment and preconception health. So if you have time, meaning if you have, up to 3 months, it's really ideal to be able to take care of yourself and your body for about 3 months, because folliculogenesis, meaning the development of an egg, is actually, really it's over a year, but it's the last 3 to even 6 months that the eggs can have, how do I put it? You can impact its growth and its development through what you do, what you eat, how you exercise and not exercise. And then professionally, you can seek out things like acupuncture to increase blood flow and decrease stress. Other things you can do is even massage therapy, self-massage, walks outside, things like that would be very, very beneficial. So again, to recap, preparation would be to, sorry, something popped up on my Facebook. Okay, to have 3 months worth of it. And unfortunately or fortunately, sometimes people just last minute are doing things, and that's okay too. You do with it what you can. Now, in terms of questions to ask doctors, well, I would say go in prepared, but yet don't question in a way that would have them think you're a difficult person. I mean, you're definitely entitled to ask questions, but just make sure that they stay on your side, right? You don't want to be looking like the difficult patient. So as I always say, that practitioners, especially fertility doctors, they can have a little bit of a godlike complex, and so they should, because they're working with life, right? So we need to be careful of how we approach questions, and how you do it is you can stroke their ego before you ask questions. And in terms of what clinics, what would you look for? I mentioned in a post last night while I texted the group that typically you want to find a clinic that is, well, you want to find a clinic that will fit you. People say, oh, who is the best doctor to see? Well, sometimes the best doctor is the one that's best for you, not necessarily one that is good for your friend, or, that you heard through someone else, because everyone's different and your needs are different. So you have to make a little shopping list for yourself as to see, what is the most important priority for you. So for example, last night I posted that, if you are living in Scarborough, for the people that are living in the Toronto and the greater area, you might not want to go all the way to Markham, even if the doctor sounds like they're really excellent and that's who your friend went with and was successful. Because logistically speaking, if you have to go to a fertility clinic almost every day, that can cause a huge amount of stress. And people typically do this right before work. So imagine trying to get to work, in the middle of rush hour, but like you're also trying to get to these clinics every morning before work. So that would be very, very difficult. So that's one thing in terms of logistics, location. And then secondly, you need to ask yourself, what are the most important criteria for you? Is it the doctor that you want to be able to be empathetic and listening? Or do you want like the warm and fuzzy type of doctor? Or are you the one with a no-nonsense kind of way of being, so that you want the doctor to be upfront? And to be very honest, most often when patients come to me after they consult a physician, a fertility doctor, they often come in weeping because they normally don't have much in the way of good news, because basically, reproductively speaking and statistically speaking, at a fertility clinic, if you're 35 and over, you're considered old. So that is upsetting to hear, and yet, I'm telling you, and through my experience, that sometimes it doesn't matter what they say, you may be fine. And sometimes even the diagnosis, I wouldn't let people categorize you in a way that will label you, and do not live by that, because you can be and live beyond your diagnosis. I've seen many miracles, and what I find interesting, I've told this to many of my patients, but I remember one day telling one of the doctors I know, I said, this patient you used to see for IVF, they had a couple of failed IVFs. And when I saw them, they're now actually pregnant naturally. So what do you think about that? And the first response was, oh, well, it can happen. And then it was like it was dismissed. So what's interesting about that is, when there's a dismissal of miracles that happen, it's like they don't exist. And what I see is that people go from clinic to clinic or quit altogether. So I see these real life couples that may end up getting pregnant anyway, despite diagnoses and despite their fact of saying, the only way is IVF. Not to say that IVF can't work, but it does work. But, just be open to possibility. This is my first live stream, so I don't know if there's any question. We only have a couple of people here, but that's okay, so we can keep it nice and short. If there's any content that you think I should discuss, that would be awesome too. I mean, this is how I see it when it comes to fertility. They say it takes a village to raise a child. Well, I say it takes a village to make one. So I'm hoping to be part of your village, and hopefully lots of other people will be part of your village in terms of trying to conceive too. Hi, Andrea and Jessica and Bidu. I see that you guys are on, but what's very funny is that I don't have anyone that's not going through fertility issue at the present moment being on. So do you think you have a question that I should address for people? If you do, please go ahead and send a comment. Otherwise, I'm going to be finishing up very soon. What else can I say? Well, this is my first time, so maybe we'll just keep it short, and perhaps next time we'll have more people join in. I hope to be doing something like this every week, and if there are suggestions in terms of topics, that would be really great too. And I'll be posting them as a recording on my page so that it'll be there indefinitely as good information for people. And so for future talks, I would be welcoming any kind of ideas that you may have, and I'll just cover it, and any Q&A or any topics itself. Yeah, that's it. Thanks for watching, and maybe I'll do it again when there's more action. Talk to you later. See you soon. Bye.